So my name is Adolfo Galarza. I'm a student at Kaiser University. This is part 2 of my IM injection, the actual IM injection itself. Due to campus closing early on Saturday and not having anyone to sit down and do this with me real quick, I am going to be both the patient and the nurse. I would do everything as it needs to be done and correctly. So here I go. Hey there, Miss Jamie Johnson. How are you doing today? Awesome. I do have a couple of medications here to do for you. Can you go ahead and give me your name and date of birth? Okay, 5/11/1969. Awesome. Thank you. You mind if I go ahead and scan that wristband real quick just to make sure? Thank you very much. Awesome. You are exactly who you say you are. Thank you very much. So let's see. Do have a couple of medications here for you. Go ahead and scan the barcode real quick on that wristband. Awesome. So I do see that I have a couple of medications here due for you at 4 p.m. I have your furosemide for your edema. Does that sound correct? Okay, thank you very much. And then I have your ceftriaxone as your antibiotic. Does that sound correct? Okay. I also see that you have morphine here as PRN for any pain. Do you feel anything? No? No pain? Awesome. Okay, well, I'll go ahead and hold that then. First off, I will go ahead and start off by hand hygiene. My furosemide is 5 milligrams intramuscular, and I have 10 milligrams per 1 ml. That is going to be 0.5. I'm going to go ahead and drop 0.5 of furosemide. I'm going to use a 25 gauge by 1 inch needle. I'm going to use 25 by 1 inch gauge needle, a 25 gauge by 1 inch needle for those IMs. Before I go ahead and draw up the medication, I am going to clean the vial for 30 seconds. And due to timing purposes and the security guard telling me to hurry up, I'm going to go ahead and say that was 30 seconds for both. First up, I'm going to draw up my furosemide. I'm going to go ahead and drop 5 mLs, midpoint 5, not 5. air bubbles out. This does have a safety lock. Just go ahead and show you that it's 0.5. Next, I have Subtraxium since it was reconstituted in the last video. It was a 2-gram vial with 5 mLs. And the order here is 500 milligrams, so I will go ahead and draw up 1.25 mLs. One 1.25 mLs. Okay. Since I'm gonna go ahead, and before I go ahead and give the injections, I'm gonna go ahead and scan the medication so that way it's in my MAR that the medication is administered. Since I have my furosemide here, this would go in the deltoid. So you would go ahead and find the acromion bone. You can find it by having your patient lift their arm like this, and then just either go 2 to 3 fingers width down and put it in the delt right here. So if Miss Jamie Johnson would get her furosemide shot right here in the deltoid muscle. So the way that would go ahead and be administered. Luckily, I have brought backups because I did not know that the safeties do not come on. And they're both still 25 by 1 year. So I'm going to go ahead and switch those out. Since these were already capped, they can go there. Like I was saying before, she would get in the deltoid muscle at a 90-degree angle, straight through, and press. And put the safety lock back on it, and put that in the sharps container. Now, since the Subtraxium is 1.25 mLs, this will actually go in the vastus lateralis, and the best way to find that is to chop the thigh muscle into 4s, and then go in the outer right quadrant in the middle. So the vastus lateralis would be right there, and then I would go ahead and inject that in the middle of the vastus lateralis like this, but I am not my patient, so I would just go ahead and go at a 90-degree angle on the vastus lateralis and inject. Pull that out, cap the needle, throw it in the sharps container. Okay. All medications administered. How do you feel, Miss Jamie Johnson? Amazing? Okay. I'm gonna go ahead and finish docking on my assessments and everything. I'll be back in 15 minutes. Here is your call light. I'm gonna go ahead and lower the bed to a comfortable position for you. Is there anything else I can do for you? No? Thank you. All right. Well, you have a good one.